Warm good evening, one and all. Myself, Shri Krishna, Assistant Professor, Sri Devaraja's College of Nursing, and our team from Sri Devaraja's College of Nursing are privileged to be associated with Unnati Foundation for this opportunity to discuss on building self-care and courage among nursing and paramedical team during COVID crisis. On this occasion, I am privileged to introduce today's resource person, Dr. Zeenat Karina J., HOD, Medical Surgical Nursing Department at Sri Devaraja's College of Nursing and Chief Nursing Officer at R.L. Jalapa Hospital and Research Center. Madam completed her UG in Government College of Nursing, Bangalore, and PG in Christian Medical. Doctors, paramedical officers, policemen, sanitary workers, and other engaged in different duties in the fight against COVID-19 are now called as Corona warriors. Needless to say, doctors, nurses, and people working in healthcare sectors are particularly vulnerable to the highly infectious disease. In response to the global pandemic, the under-resourced healthcare professionals are facing unrecommended challenges. The list of the sleep-deprived heroes includes doctors, nurses, pathologists, paramedicals, ambulance drivers, and healthcare administrators, and so on. In the fight against corona warriors, a brave medical army stands strong with thermometers, stethoscopes, and ventilators as their weapons. Not to forget, medical researchers are working day in and night out against all odds, hoping to find the antidote to the disease. Because of this fear of death, infection, and family health, and so on, healthcare workers are at stake to take a decision to continue their work or stop down in the major crisis. Madam, how do you feel that we can build courage and self-care among nurses and paramedical staff at this situation?
Good evening, and it's our privilege to speak under the banner of Unnati Healing Foundations. And as my colleague was highlighting on healthcare providers' crisis in this pandemic COVID-19. And he has put me a very classic question on how to build this self-courage and as well as the self-care among the nurses and paramedical team who are at the bedside of the patient. Of course, it is a tough task, but the self-care and courage can only start from the commitment of the healthcare providers. Today, we stand in the scenario of what tomorrow. But still, there is an answer where each one of us as healthcare providers can take a challenge to build ourselves and courage to meet the needs of this wonderful crisis. I just would like to highlight there are frontline warriors who have lost themselves in the service of others. It is none other than the doctors, nurses, paramedical team, and even the housekeeping department who are constantly, committedly serving the people to keep the world safe. I really tribute a kind of appreciation to this team as they have committed themselves for the sacrifice of others. Researchers are still on their go to find a solution so that we could live a normal life in the nature that God has created. With regard to building self-care among the nurses and paramedical team, here the nurses who spend a lot of time with the patients for long hours duties and the care that they render calls for a specialized technical area where they need to expose themselves more and more for the risk of COVID-19. But still, this year being the year of the nurses, they have stood as a spotlight to the whole universe to say that we are here to care for the sick. A simple and a small advice for all the healthcare workers, to the nurses as well as to the paramedical team: take courage to build your self care. Self care mainly focuses on any activity that we do deliberately in order to take care of our mental, emotional, and physical health. This talks about the holistic aspect. Of course, it is very difficult for us to balance and to have a holistic concept, but still, good self care is key to improved mood and reduced anxiety. I would like to highlight on few dimensions which mainly focuses on empowering each one of the healthcare provider to build themselves so that they can be a source and a channel of blessing to so many suffering with COVID-19. When we think about the self-care dimension, it is just like an iceberg phenomenon, which is submerged and only the tip we all of us are seeing. There are 8 dimensions. The first dimension talks about systemic dimension of self-care that mainly focuses on physical health, habits around our eating, exercising, and sleeping. If our systemic dimensions of self care is sound enough and harmonized, we feel that we are alive. The second dimension talks about emotive dimensions of self care. This talks about our emotions in terms of communication skills, our triggers, and responses to what's happening around you. If our emotive dimension self care is sound enough, we feel at peace and we are calm at every crisis that we face day to day. Luminescent dimension of self care. This is very wonderful. I really loved it. Illuminate your inner truth. Most of the times, the self care workers, they illuminate their truth and come forward for the altruistic service. So they are unique and they will identify their strengths, gifts that they have, then spiritual nature, values, personality, and individual preferences. This all makes them as a unique they are. So this luminescent dimension of self-care helps us to develop finally the confidence. So she feels or he feels very much confident. Coming to the fourth dimension, financial dimension of self-care. As many scholars say that a right time saves the life of a person. They would focus their attention on what they want rather than what they don't want. The next, the supportive dimension to the cognitive dimension is the aptitudinal dimension of self care. This aptitudinal dimension helps the healthcare provider to contribute to the world, that their life's purpose and what they are doing uniquely to this world. So, here with the aptitudinal dimensional soundness, a meaningful contribution to the world takes place. Relational dimension, of course, this is very, very important in collaborating, in counseling the healthcare required people.
how we connect with others, and then how they explore their personal relationships, their friendships, partnerships, and family relationships is very important in this COVID crisis, as many are losing their relationships because of the severity of the infections. So, if a healthcare provider maintains a sound relational dimension, then she can create healthier connections mutually, which is beneficial and respectful. Finally, we are living in the environment which is created by God. We need to connect it with our nature on whatever we are trying to do. And here, coming in specific to the environmental dimension, it is how we harmonize ourselves with the nature, interact with the world around, engage with our community, the environmental impacts of our decisions, especially the healthcare environment where technology, where the sophisticated skills are called for, we need to be sound and updating ourselves. So, if our environmental dimensions of self care are grounded or they're sound enough, then we can connect to the world around for a better contribution. I hope that these types of self care dimensions, if we really inculcate in our practices, we would be able to make ourselves more good in providing care to the others.
Hello.
And Sri Krishna also has asked me on how do we build a courage?
Hello.
Courage comes only when we have got a kind of commitment towards developing that habit. Before I go on to the courage, here is a boost for all the healthcare providers. Dear healthcare providers, your reward is awaited. Build your self care based on these 7 pillars. First is develop the knowledge, have mental well being, have a good physical activity, have a good healthy eating habits, avoid risks as alcohol, smoking, or any other habits, develop good hygiene practices, and follow all the dimensions and the SOPs given by the WHO, and then use of rational products as well as the services will make you stronger in your self care. Building courage among the healthcare team members. As rightly said by Anne, she says that courage doesn't always roar. Sometimes courage is the little voice at the end of the day that says, I'll try again tomorrow. I think each healthcare worker, when they go back after their work, they'll say, what tomorrow? But if there is a message saying that I'll try again tomorrow so that I can make it a better world with lots and lots of courage among the patients as well as the sufferers. Here, every healthcare provider should possess these 4 types of courages. The first courage talks about the creative courage. You create and empower that courage within yourself so that your techniques, your care, your communication, your counseling will give a great courage to the people around you, your co workers, and your subordinates, as well as to the patient who is listening to you. And the second type is very important. Professional integrity and moral type of courage is very, very important. Every act that we do, it should be rational, it should be professional, it should be ethical. So when we do it morally, I think we are more stronger and more right in our professional performance. And also, we should have a physical courage. Most often, whenever we face a situation in the ICUs or in patient care or with COVID receiving, we may have no physical courage, but it is we who have to take precautions and go forward to say that, yes, I can do this. Develop the habit of physical courage. Social courage, this is very wonderful. These days, we need to have the voice that is raised to talk to the society on the right things that they have to do and the things that they are supposed to avoid. So that by using these types of courages, the healthcare provider could make this society more free from the fear, anxiety, and also the thoughts of what next tomorrow. Here, just I would like to put the courage in a circle of what to say aspects. Here, the circle of courage mainly talks about each healthcare provider should possess the purpose. This purpose mainly talks about I am considered to others. And this purpose should connect with belonging. That belonging should develop within themselves that I am important to someone. And after we have developed that belonging, we should also have mastery. That mastery will solve the problems. And after I have developed that mastery, I should be able to go independently to take a task in healthcare. That is, I am in change of my life. So the circle mainly focuses on purpose, belonging, mastery, and independence. If we possess these qualities, I think we would be able to stand very boldly and say that, yes, I am doing the things for the betterment of my patient. Finally, I would like to put this courage in a nutshell, saying that you need to act on what you have chosen, not to be scared, and then following our heart's cry, what is right to do. And we should have persevering where to face the adversities that we are facing. And then we have to stand up for what is right. And most often, the healthcare providers goes on to a routine. But here is a message to stand courageously is expanding your horizons, letting go the familiarities, and then finally facing the suffering with dignity and faith. If each healthcare providers empower themselves with self-care and courage, I think the crisis of COVID would wind up at the earliest, where everywhere the healthcare providers are ready to deal with the crisis that is happening. So I think I have covered on this uh,
Yes, ma'am.
developing self
You have clearly
and
elaborated on self care and you have shown many strategies how to build a courage. Ma'am, according to you, what is the most this nursing staff and paramedical team are going through due to COVID? What are the mental and emotional challenges what they face at current scenario?
with regard to the most challenging crisis, as I take it, every human being has got a holistic approach and holistic concepts. And as already I have highlighted on self care, which consisted of physical, mental, social, emotional, occupational, etc. In the same way, when I just list the challenges or the crisis that healthcare providers are facing today with COVID-19 crisis is being put up in a wellness circles. The first thing what I would say that is physical challenges. Physical challenges are nothing but they are the most important one where the healthcare providers are becoming weak in taking decisions with regard. And we also have got intellectual, environmental, emotional, financial, social, spiritual, and occupational. Physical is what they get exposed to the infections or they're scared of death. Intellectual, their thoughts are blocked. What next? Environmental, adequacy of the health safety precautions, whether that is provided at the practice sectors. Emotional, decisions on balancing family as well as the work and orders from the higher authorities, along with the call of the patients. Financially, They are unable to balance most of the times because of this COVID crisis, as they are not satisfied with what is happening around them. And socially, there is a large social stigma after the healthcare provider functions in a healthcare setting. When they return home, there is lots of resistance that is being created by the community as well as the public, where she is feeling isolated, and spiritually she is not able to find that peace of mind to connect with her creator. And occupationally, if she misses her job or gets absent, what happens next? She may lose the job and earnings will be lost. So, therefore, what I feel here is the most challenging crisis are it is the holistically, the whole portions, whole dimensions of her life is being affected with that. But I would concentrate mostly on other challenges which are having, which where the healthcare providers are facing is acute shortage of healthcare workers because of either quarantine or attrition or because of non-commitment or because of no safety healthcare provisions that are being provided. Then healthcare workers attrition also is one of the reason, or absenteeism. One day working, getting exposed, working under the PPE for a long hours. Next day there may be an absenteeism. And even the healthcare workers are facing violence. When they go out, they are not permitted, nor they are taken care well. There is a respect and dignity that is being provided to them. This also is making the healthcare workers' emotions go down. Then social isolation and stigma. This we have to talk. It's a large task that takes us to build their courage to live in the society, and a shocking professional demands. And all the cases, those who are affected with COVID-19, they are falling into a requirement of modernized and technological care as ventilator care. So all these days, the care of ventilation was to a very severe patient, but most of our COVID SARI cases are requiring the ventilated care and technologized care. So therefore, a professional demands are increasing day by day. And long duty hours, if absenteeism takes place, the nurse has to continue, or the paramedical person has to continue. An increased workload and long hours in the PP is also another challenge that the healthcare providers are facing. At some institutions, there are shortage of PPE, or the infection control protocols are compromised. Most often, ethical dilemmas as no bed policy, and the nurse is also having what to do next when a proper safety precautions are not taken care. So these are the ethical dilemmas that they are facing. And family demands. She is in between of the family as well as the work. So that is making her go into a great challenge. But to deal with all of these challenges, we had to be taking care of them in terms of their anxiety, depression, stress, and then all the other physical needs, nutrition, etc. And most often, another challenge that the nurse and then healthcare providers that they are facing is lack of counselors at the workplace. They are not able to share their feelings in the right time. There were also an incident recorded by WHO. An Italian nurse committed suicide after being traumatized trying to save the lives of those with COVID 19. But still, there is an answer for all these crises that they are facing. How we could develop a strategy to manage this crisis management is making every healthcare provider a kind of trust relationship. And we have to develop the enrichment, make a team, conduct training programs, and then you develop that self-care concepts and train them on care of the patients and enrich them. The third one is make them function with responsibility for their self as well as to the patient and to coordinate with their healthcare team. And the person who is a healthcare provider also should be connected with the community to save the community from the mistakes and also as well as from the other aspects. Here, there are few things where the nurse as well as the paramedical workers could use their strategies to manage their stress in the COVID 19 crisis. There is time management, spending time onto the nature, practicing yoga, meditation, prayer, making their hobbies more prominent, exercising, and other therapies, whatever they could feel that they are comfortable. So, here, what I would like to say is the crisis faced by COVID warriors is not one, it is multiple. But there is an answer if the administrators or if a healthcare provider takes a call in the right time for the right cause for the better healthcare.
Truly spoken, ma'am. And since the coronavirus outbreak, healthcare professionals have not only experienced the gratification of healing patients and saving their lives, but have also lost many of the battles along the way. On top of that, many health workers have even sacrificed their own lives, as you gave an example, in the line of duty. Ma'am, how to strategize the self care and courage of an individual during the crisis at professional level, might be family level, or at the social level?
Okay, with regard to this, when we are trying to manage the professional level as well as personal level and the family level, here are few strategies that I just would like to highlight on. Like at a professional level, changing the way we work or you work, that would help us. And personal and family life is changing the way you see your work. You take it as a risk, then it is a risk at home also. If you take it as a challenge, it is a challenge at home also. And changing the way you be after your work, that is at the societal level, that is what you do, what footsteps you place in your society and community, that would be followed very strongly. And coming to the strategies, what I feel at a professional level is every healthcare provider should empower themselves for training and retraining. This is very, very important because training and retraining should focus on something called as wearing a PPE, management of infections, management of biomedical waste. All this has to be taken care. And then technology use also should be taken care. So each professional should make themselves aware about what is COVID 19, the mode of spread, and the precautions that has to be taken during care, after care, and even at quarantine areas. The next is establishing a scientific reasonable shift schedules. I think whole universe has made schedules and reschedules. In the area where I am working, we have made a three-team system, and of course, it is functioning very well, and adequate rests are there by the time the next schedule comes. So, therefore, what is happening is the whole of the healthcare providers are divided into different three teams with 6 hour shift a day. So, that is also one of the strategy where people could feel better and perform better and adhering to the infection control protocol. Of course, wearing a PPE, donning and doffing is a technique that is being taught, but now it is practiced more. That has to be practiced for the safety of the healthcare provider as well as the others. And hand washing should be done very, very particularly. And then here, the healthcare providers, when they are confused, conflicted, and not able to go on, they need to seek the psychological counseling. It could be a practice related, it could be a knowledge related, or it could be related to something anxiety, depression, or personal level, where they could find a solution from the psychological counselor provided at the organization. Then avoiding unnecessary contacts who would either through a communication or either through some other form you are developing more and more contacts which is disturbing your professional level performance should be avoided. And maintaining good physical, mental, social and emotional stability would also help each of the professional to be more prominent in her professional skills. And finally, what I would like to say is balancing between the work, family, and society is also one of the key aspect at a professional level. This I have placed it in a very, very nutshell way. Here, at a professional level, there are cases asymptomatic, mild cases, and cases those who require ICU. So, therefore, I I always feel that each one of the healthcare providers should decide to empower themselves by training, retraining, ongoing skill development so that we could perform best at our professional level. These are few pictures which mainly talks about donning, doffing, and then talking about wearing a mask, and then making every healthcare provider, it is in a red what you are expected to do. So the family that is watching at you would be feeling, yes, this crisis is not bringing a change in every activity. They would cope with that. Do the things that get disproportionate results and then focus on things only you can do and do the important things which must be done now. And quality time with the family, quality time with the children, quality time in developing yourself would really help you to balance between the work as well as the professional life. And at a society level, I think these days, newses are breaking our hearts rather than the COVID crisis. The news and the communication medias that are taking place is very, very disturbing and pathetic. So, here are few tips that I would like to highlight on communications that support mental and psychological well-beings in different target groups. Encourage on these positivities. Then always we have to be teaching in our community to be empathetic to all the COVID affected uh, clients, not to treat them as victims or cases or deceased, and not to say that because of some wrong things he has developed this disease. I think community should be made more and more aware about this. And the fourth point I would like to say that minimize watching, reading, listening news about COVID-19 as much as possible unless you have got the reliable data. You please don't get disturbed by all these news. I think WhatsApp is really giving lots of news. I don't know whether it is real or not, but it is panicking the whole of the community. And we have to protect our community by supporting to others. Now the crisis, what is happening in the society is one gets positive, he is in the hospital, remaining all in the quarantine period, no movement, nothing is happening. So during that process, the other community should be able to help them and support them and then find opportunity to amplify positive and hopeful stories where people got discharged after the treatment and people those who have experienced COVID and the family stories could be amplified so that the community and society feels more stronger. Then honor the carers who is providing care at home or at centers or even the doctors, nurses who are really working at the bedside. And then at societal level, it is also important for the healthcare workers to take care of themselves because they may directly get exposed or people may react violently. So therefore, we have to take care. Then avoid unhelpful strategies, unwanted strategies like depending on somebody who is really not truthful in building the community to be avoided. And then stay connected with the family is very, very important. And then we should also have a counseling for all the healthcare providers so that their energy would be boosted every time so that they could go on with courage and care. And good communication is also one of the strategy. And give care to the vulnerable team as pediatrics, morbid people with hypertension, diabetes, or elderly people who are in the community so that it would really help us. Here, finally, I would like to say if that particular area is affected with COVID or any family or a person is found, you can educate that particular person to keep the documents which are necessary for registration to the hospital with a kit where they could go take treatment if they had to be hospitalized. That is very important key message that we are supposed to give to the society so that they feel, yes, even if COVID is affected, I would be able to prepare myself, go happily, and come back healthier to the society so that I would keep my society very clean and very safe. And here are few aspects. This, anyway, I'm not going to talk in detail, but every healthcare professional has got a responsibility of sharing on what is this COVID 19, how it comes, what are the real facts, what is the mode of spread, what are the symptoms, what they have to do, what are the helplines that are available to seek a medical aid should be communicated at the societal level so that nurse could make and healthcare provider could make a great contribution at the societal level.
Very practically spoken, ma'am. I think everything what you told was simple to follow. Hopefully, everyone will agree with me. Okay, the world is taking the healthcare professionals and hospitals more seriously nowadays. As it appears, more work is expected to be done for hospitals and intensive care units to strengthen the healthcare facility and infrastructure in India as well as in countries across the world. Madam, at this situation, how to motivate other staff around us in this situation?
Again, coming to the process of motivating. Here, what I see is motivation is ultimately a will to work. Of course, our frontline warriors have come forward by their own will to work. Here, motivating is nothing but this is an enjoyment of work itself from their desire to achieve certain goals. Again, I would like to pay a tribute to all the motivators who are standing in front to manage this crisis. And here, there are few ways how we can motivate. I know the first method would be everybody would ask on what is my safety, what is my salary, and what are the benefits that I am going to get. And also, there are non financial methods also are there to motivate the healthcare workers. Here are the two types of employees who are working here, unmotivated and then motivated. Motivated will be always having a sense of purpose and they have got greater commitment, better communication, and higher production. But whereas unmotivated employees have got less job satisfaction, less commitment, and more of miscommunication and more of turnover. In this situation, I know every COVID centers are most of the times facing this unmotivated employees. But still, there is a challenge that is existing with us to make them work more and more motivated. Here, if we have the motivation, it will help us to puts the human resources into action. And if we motivate the people, it will improve the level of efficacy of the efficiency as well as efficacy of the employees. And it will help us to achieve the organizational goals and it will build friendly relationship and attrition rate will be reduced. So it leads to stability of workforce. So it is also the responsibility of the organizations to see that every employee, it would be a doctor, nurse, or the paramedical, even the maintenance staff as well as the housekeeping, should be stabilized with their good motivations. Here, steps to improve the employee motivation. Here, the first step, what I feel is enable autonomy. Maybe in the beginning, when we were talking, you have to go to the COVID ward, there was a resistance, but still, with the good counseling and good training, I think the employee will develop a autonomy. Next one, recognize the effort and achievement. That is very, very important. Whenever they do something, I think we need to recognize their effort and try to say that you have done your best. Next one, we have to be positive. Choice to embrace the failure. At times, we are not always successful. So we have to encourage them to even face the failure and take it as a stepping stone for the next development. And we need to keep on encouraging them on communication so that they would be able to take a call on making their contribution more best at this COVID crisis.
I am getting motivated, ma'am, to work in COVID world.
Yeah.
And while the deadly virus has brought attention to the inadequacies in the healthcare system and across the globe, doctors and healthcare workers have been risking their lives to save all of us. They are also risking the lives of their family members, which indeed is a huge sacrifice. Madam, how to strike a balance between healthcare profession and family safety?
Yeah. So here I think that I have already spoken, but I just would like to share with all of you a three-factor model to balance between the work and the family safety. Family safety is, of course, the responsibility of the healthcare provider because the family may not be aware about the precautions or the safety measures that they have to follow. But as a knowledgeable, trained, skilled person should take a charge on empowering each and every family member so that they would adopt to the practices for their safety. The first thing that the healthcare provider should have the knowledge to balance between family and the work. The knowledge related to work areas is what is my organization, what is my environment, as well as the functions. So, based on that, he or she should balance at the family on what what is she and what are others and what are their tasks. So, if very vulnerable family members are there, take a call to provide special precautions to them by immune boosting nutritions and counseling and encouragement. So, the first factor of balancing is your knowledge makes you more rich in giving safety. The second one is behavior, the way you act. If you act always with a mask and avoid them communicating, I think they would develop a fantasy. Behavior also should be talking yourself development, knowledge development, plus the courage to deal with this crisis. So, when you are at work, your roles of profession and then formal behavior should be very apt. There is no compromise on that. And when you go back to the family, maintain the relationship with the children, with the elders, with the society in an informal way. And coming to the last one is the skill. Skills, I think now already I have mentioned that a specialized skill is required in this COVID crisis to balance. So you should be very good decision maker at a workplace, communicator, and technically having the expertise. Coming to the family, you should have that peacekeeping, sharing, as well as networking. If these aspects are balanced well, the key message that I would like to give here is working and home management is a great balance if you are sound in your mind body and in your spirit. You would carry on a balance very easily.
Truly, ma'am, I think you have covered all the dimensions, but still, every time we strike one more thing in our mind. Does spirituality has any what to tell role in enhancing one's overall well-being?
As I started my session saying that every human created by God has got a holistic man himself. Okay, so spiritual well being is the ultimate. This is connecting ourselves with the higher powers or God. So, spiritual well being means the ability to experience and integrate meaning and purpose in life. I think this has got a great influence. If a healthcare provider's spiritual well being is very sound, I think she or he can perform very, very confidently. And she can relate herself with others, and she can relate with the nature, and she can be a powerful resource so that she can influence the whole of this COVID crisis. Here, I just would like to highlight on some of the characteristics or some of the signs which we could see where a person, when COVID-19 crisis came, I think most of us have experienced what God, what is happening, where what is this nature is being affected. So spiritually healthy person, but had that hope, yes, one day we are going to have a good results, and then positive outlook he had, acceptance, then forgiveness, then commitment, meaning and purpose, clear value, sense of worth, peace, worship, prayer, meditation, so on and on. Dear healthcare providers, if you are sound in your spiritual life, your hope is never lost, or your positive outlook will never make your patient feel nothing tomorrow. There is a tomorrow with hope. So we should encourage as healthcare providers, and we should also be empowered in the spirituality so that that sense of worth and meaning of life would be explored more and more and much better. So here there are few strategies that we can little practice in our life, that is exploring our inner self. We have to take time to think about who we are and what we are. And then we should also experience life changing event that will take few minutes thinking about what series of events has led to this success and this hope and this moral life. And then these days there are many integrative medicine techniques have come, many natural techniques have come, which is helping us to spend time so that we would really relax and connect ourselves with the creator. So spending time in meditating and quiet time also is strengthening the spiritual well-being, and practice acceptance, that is also very important. And we need to be very curious on something that is happening so that we will be able to take a moment to explore on that experiences little more deeper and seek God's help, and look for a religious faith that is there, that we agree upon, so that that would really help and empower the healthcare provider so that they would strengthen the others around them as well as patients. So here spiritual well-being, as you really asked me, that saying that in spiritual well-being surely empowers the nurse providers in this COVID crisis.
Yes, madam. The stories of the medical heroes putting themselves on the forefront to fight the virus are inspiring and heartbreaking too. At the same time, they deserve all the appreciation and support. The sacrifice of doctors and healthcare workers across the globe will not go to waste. But humanity will always be grateful to them for what they are doing during these unprecedented times. Madam, can you please share an incident that touched your heart of nursing staff during this crisis moment?
Yes, sir. I have many stories to be talked about. Stories of lots of success, many patients, those who have got discharged, are very old patients where we thought there is no survival rate. And recently also we have heard 100-year-old person got recovered and gone. So the success story, what I would really feel is the healthcare providers who are behind the scene have really helped by taking risks to make them go home happily. There are many and many and many successful stories. What I generally feel is when I asked a nurse or a paramedical worker or a housekeeping person, please go and do the COVID duty, when they first said yes, that was my success. I really feel that that was their commitment to their call for which they are being in the human service. There are many stories are there and many real lives who have really said a great salute to these frontline barriers. I think I just would say that successful story is when a healthcare provider said yes to the call of COVID crisis. And here, very heart-touching incident. A patient who had SARI came to the hospital, got admitted, and due to his comorbidities, we couldn't survive the patient. Patient died, and nobody to take a call. Even if they take a call, they are quarantined. They are unable to come. They are not able to reach. But the frontline barriers, what a great step. They took a call and they came forward, even though the religion was different, the caste was different, everything was mismatching, but they came forward to show their dignity for this last office service. It was very heart touching. Not even one family member around the body or to give a tribute to their family, but still, who stood was, it is none other than my frontline warriors. I think that makes me feel more privileged and proud to be a part of this healthcare team. I think there are many more. There are many more. Many were left unattended, but the call took by every healthcare provider was a great achievement in this COVID crisis. I think it's really a challenge.
Yes, ma'am. It was really heart touching. You have clearly brought out everything, ma'am. Thank you, ma'am. I feel you have clearly enlightened us with your knowledge and experience. Here, where this is where I think the experience counts. The bravery shown by these warriors while fighting coronavirus is certainly venerable. The bravery with which India is fighting the coronavirus is truly admirable. We salute its heroic corona warriors. We have to free the nation from coronavirus by turning challenges into opportunities and set an example for the world by creating a healthy, prosperous, and strong nation. As I thank everyone, and I also thank Unnati Health Foundation for giving us this August gathering to share our thoughts and for the opportunity. Thank you, ma'am.
I would also thank for this great opportunity, especially to Dr. Kumar sir, who is the chief advisor, who made us a part of this Unnati Healing Foundation. Thank you.
Thank you very much. Thank you all.